JBN, we keep you informed. Man killed, 2 sisters among children injured in Mount Ogo gun attack. 1 man was shot dead, and the 2 sisters among 3 children injured in an attack in Mount Ogo near Lawrence Tavern, St. Andrew on Sunday night, March 29. The St. Andrew North Police said the incident happened about 8 o'clock at an area called Escorna. The deceased has been identified as 28-year-old Zaylon Duncan, otherwise called Prime, and a poster from Escorna. The other victims are 2 girls, one age 8 years old and the other 9, as well as a 17-year-old boy. The details of the incident were not immediately ascertained. However, the police said residents reported hearing explosions and called them. Investigators rushed to the scene and took the victims to the hospital, where Duncan was pronounced dead. Portland records first murder for 2020. Jason Pendley, a 45-year-old farmer of Tower Isle, St. Mary, is Portland's first murder in 2020. He was shot and killed in the Buff Bay community on Friday night. The police are reporting that Pendley was walking along Horse Pond Road just outside Buff Bay Blueberry area, along with another man about 10:45 p.m. when they were pounced upon by 2 gunmen. According to the police report, Pendley and his friend were ordered by the gunmen to lay face down and were robbed at gunpoint. Afterwards, the police surmised that Pendley was shot in the back of the head, with the other man also shot. The other man, whose name was not offered by the police, ran and was able to escape. Pendley was taken to the hospital, where he was pronounced dead, while his friend was found by the police and also taken to the hospital. He is said to be in a serious condition. Last year, Portland recorded 6 murders. The Portland police are investigating and are asking those who can assist to contact the police at the Port Antonio CIB at 876-322-9263 or Superintendent Dwayne Wellington at 876-882-3598. Manchester farmer arrested on firearm charges. A Manchester farmer is now behind bars on firearm charges after being arrested on Friday night. The police say 28-year-old Nadar Campbell of Savoy Crescent in Christiana was held during an operation at a bar in Mount Moriah, St. Anne, about 11 p.m. after he aroused their suspicion. The police say Campbell was searched and a 9mm handgun with 13 rounds of ammunition found in his waistband. Campbell has been charged with illegal possession of a firearm and illegal possession of ammunition. The police say his court date is being finalized. Senton teen suspected to have drowned. 17-year-old Kingsley Campbell of Sterling District, Calderwood in St. Anne, is suspected to have drowned at a beach in Prairie in the parish on Saturday. The St. Anne's Bay police say about 4:49 p.m. Campbell was at the beach with a relative when he complained of feeling ill. The relative reportedly left to buy food. However, upon returning, Campbell could not be found. An alarm was made after Campbell's clothes were found along the beach. His body was later found in the water. Several Percy Junior nurses in quarantine after exposure to COVID-19 patient. Several nurses at the Percy Junior Hospital in Manchester have been sent home to be quarantined after being exposed by a male patient who was last week tested positive for the coronavirus. Hospital sources said the patient was dishonest about his history of contact with people who had traveled from overseas. On Friday, the Health Ministry listed a 56-year-old male from Manchester with no travel history among the latest COVID-19 cases. The ministry said he was in contact with tourists from several countries, and the investigation on this case was continuing. Contacted this morning, the president of the Nurses Association of Jamaica, Carmen Johnson, confirmed that some of our nurses are now in self-quarantine. Johnson could not immediately indicate the number of nurses. However, she said it is standard procedure for health practitioners to be quarantined if a risk assessment indicates that they were exposed to an infectious disease. The NAJ president was also disturbed by reports that the patient was not honest about his history. The populace needs to understand that we want to save ourselves, Johnson said. She said too that patients must appreciate that health practitioners depend on their honesty to assist in diagnosis. The longer you're not honest with yourself is the longer the delay, she said. At the same time, Johnson is encouraging nurses to take every precaution and to ensure that all patients are asked about their travel history or contact with travelers. Yesterday, the health ministry reported that Jamaica now has 36 confirmed COVID-19 cases. This includes a health worker. The ministry did not indicate the parish of the worker or the exact profession. Scorned for COVID-19 suspect. When a well-respected Manchester doctor suspected of having COVID-19 turned up at the privately owned Hargreaves Memorial Hospital last Sunday, it sent some nurses into panic mode, causing them to breach the protocols established for the treatment of persons suspected to be infected with the dreaded disease, the senior official has acknowledged. The admission by Hargreaves Memorial came after the family of Dr. Stephen Singh expressed outrage over the treatment they claimed was meted out to the popular physician who has been practicing in Mandeville for nearly 3 decades. The incident and a subsequent voice message that went viral on social media quickly ignited fears among residents in and around the central Jamaica town where Singh is widely known. Dr. Jason Mungal Singh, who was a doctor at Hargreaves Memorial but wasn't there at the time of the incident, revealed that his mother was at the hospital with his father and described how nurses there refused to treat or even touch him. She said there was one particular nurse who was more upset than everybody else, pretty much shouting that this man shouldn't be here, leave with him, Mungal Singh recounted during an interview last Friday. Other nurses he charged directed his mother, put him in your car and leave with him. It was very disgusting and very out of order in terms of their reactions towards him. It was very unethical and very dangerous from a patient management point of view, said Mungal Singh, adding that his father could have died because of their actions. The 71-year-old Dr. Singh was later admitted to the isolation ward at the Mapen Hospital in Clarendon, has since tested negative for the coronavirus disease and is now resting at home, his family disclosed. Dr. Hazard Comrie, Senior Medical Officer SMO at Hargreaves Memorial, said that Dr. Singh was referred there by the Health Ministry. They asked me permission to accept him in our isolation room on the grounds that they heard that he was ill, having cough and fever, and that he had come in contact with known people who had COVID-19, he disclosed. Comrie indicated that he examined Singh and conferred with a consultant who had also examined him the previous day, and said they both came to the conclusion that his illness was not likely related to the coronavirus. Notwithstanding this and the coronavirus protocols established by the hospital's management, he said the information from the Ministry of Health and Wellness sent some of the workers on duty into panic mode. Everybody started to panic because of what the ministry said and because of what was inferred by the ministry's action. I am not going to dispute that at all, said the Hargreaves SMO, pointing out that at least one nurse elected to stay with Singh and assisted with his treatment. He noted also that Dr. Singh's presence at Hargreaves caused some health workers to question whether the hospital was following its own protocol, which is that suspected coronavirus cases should be transferred to the public health system. The nurses had a right to ask me if we were following the protocol, he stated. Comrie conceded that there were some breaches of the hospital's guidelines for the handling of coronavirus cases, and disclosed that the senior management team is now conducting a complete review of what transpired last Sunday. All employees who are on duty have been asked to submit a report. Things were done that should not have been done, actually. It was a lot, and that's why I said it was a general panic mode. Everybody got scared, so a number of people were not following the simple protocols, he said. The protocol is there. I can't tell you I remember every single thing, but I can tell you when I see breaches, and I can tell you when I see that they did not follow exactly as they should. So although some things were done right, other things were not done right, and I have a problem with that. I must have a problem with that, he added. Comrie suggested that it was too early to determine whether employees would face disciplinary action, saying a review of the reports requested from staff will determine where the breaches really were and see if sanctions are necessary. He noted, however, that the focus of the review will be on ensuring that healthcare workers at Hargreaves are fully au fait with the coronavirus protocol. You cannot just assume that because you give them protocols and you drill them that they're going to get it right, he underscored. When the case comes in, that's when you realize who is ready and who is not. Mungal Singh, who has since resigned from Hargreaves Memorial, said the incident with his father also triggered a viral social media message that has caused anguish for some family members, including his 3 young children. He said his 10-year-old daughter got the message on her cell phone and had a number of questions. JBN, we keep you informed. Please remember to subscribe, like, share, leave us a comment and click the notification bell to receive our daily news items.